All right, everyone, we're going to go ahead and get started. So welcome to the August 25th Davis Links Resource Forum. This is a little bit of a unique training. Unfortunately, our Findhelp Customer Success Manager is going to present how to family emergency this morning. So our Findhelp or Davis Links admin team will be covering what she was going to present. So just bear with us if it's a little bit like it may feel like maybe not as polished as she would do it, because we were fortunately able to look at her slides. So unfortunately, Andrea will not be able to attend. But anyway, we're moving along. I just want to share that our next forum is going to be September 29th, the last Tuesday of next month, from 9 to 10:30. And it's going to be in person and at the administrative building in Farmington. So the original calendar invite said up at the Davis County Health Department Annex building. That has changed. So it's going to be at the place it normally has been. And I will update the calendar invite after this meeting. Just didn't want to confuse you, maybe thinking, oh, has today changed? So just know that. And then we would like you to register in advance because we are going to have some snacks. And yeah, this is not just for those of you who have been part of the resource forums, in the past few years, we've had a networking event just to make sure that you all are able to connect. We know that there are a lot of virtual forums, so it's the start of a school year. It's a chance for everyone to get to know each other. So we're looking forward to that. And then it also is the 10-year anniversary of our Davis Links Resource Forums. So Isa and Debbie Comstock were part of the OGs, the originals of the resource forums, and we're excited to be able to celebrate with you and everything that we've learned so far. So again, that's September 29th. It'll be in Farmington, and the registration link I put here, but I'll also put it in the chat in a second. Okay, just a reminder about the Davis Links Community Announcements folder, just because we want to keep, making sure that everybody's able to go to the same place. So if you go to davislinks.org, then up in the top right of the navigation, you would select Community Announcements, and you will then come to this web page, and you would select Access Community Flyers. When you click on that, you're taken to this folder. So you can see that there are a number of flyers already demonstrated in the screenshot. There's things like the summer financial wellness from those financial webinars that USU provides. And then there are August events that Discover Davis regularly, monthly posts on their social media. There's things related to the 250th anniversary of America. There's challenges and cooking classes, I believe, or this is like a wellness challenge. There's ongoing events. So there's also like limited time events. So it's worth looking at. I did put a little arrow next to the trainings subfolder because for you as providers, that's helpful. I mean, this announcements folder, community announcements, is available for all of the community, but this is one area where it's maybe a little bit applicable with professional development and professional training. So make sure to check this folder as well and try to keep it update as much as possible. And if you have any forums that you would like us to, or excuse me, not forums, if you have any flyers that you would like us to add, you can always reach out to our to me or our Davis Links admin team. So I will also give you that email that you can reach out to in the support. You can also go, let me go back on the website. So on davislinks.org, the main page, if you scroll down to the bottom, there is a form that you can fill out to connect with us, and you can ask or recommend that we upload a flyers or add a resource. Okay. Any questions about anything I just mentioned? Okay. So I still, even though we will not be having Andrea for those who just joined, unfortunately she is not able to make it due to a family emergency this morning. She let us know. So she is our senior customer success manager. I still just wanted to read her bio just so you get a sense of who she is. She's someone that we meet with every other week, so twice a month. And she's very passionate about public health. We're fortunate to have her. So just read her bio. She's an MPH and CHES certified. She's a public health professional, passionate about connecting people, systems, and policy to create lasting community impact. And she's part of the Findhelp team. She partners with county government entities like ourselves to guide platform implementation, foster cross-agency collaboration, and drive sustainable platform adoption. So she's really been helpful in helping us think through our overall strategy, how we're going to help all of you with the tools that you need. And so a lot of you know about claiming and, claiming, editing your programs, that kind of thing. And Isa will be covering much of the slides, and I will be chiming in, and potentially Kaylee, if she's joined. She's part of our Davis Links admin team. And okay, so with that, I'm going to open the other slides. And if you have any questions that have been burning questions about the platform, I know we've done a lot of trainings. You are welcome to put that in the chat. We'll look at it, we'll answer it as we go along, because we know that you may have questions as providers about the overall platform and any tools that you would like to, or that you may have questions about, or we can see if it already exists in the platform. So let me, okay. Sorry, one second. Huh. Okay. All right, is it showing? Looks like it is showing the screen. So I'm going to pin that so it's easier to see. And with that, I will turn it over to Isa for the main part of this presentation.
Hey everybody, good morning. I'm Isa Perry. I'm Health Strategy Manager at Davis County Health Department and coordinate Davis for Help. So thankful for your interest in Davis Links. Earlier this month, Marcy Clark and I were able to present at the Utah Social Care Summit, and it was a Findhelp sponsored event. So there's some thoughts in my mind that I might weave in of things that we learned during that summit, and as we learned from other providers who are using this platform. Travis, myself, Kaylee, and Marcy are the Davis Links admin team. Marcy's out of office this week at training. So, but we have been meeting with Findhelp for 2 years, every other week. So hopefully we can answer your questions, but if we can't, we will definitely follow up and get those questions answered. All right, next slide, Travis. This is the Findhelp's mission, to connect all people in need and the programs that serve them with dignity and ease. And their vision is to power the American safety net by simplifying the process of connecting people to help. So Findhelp is the top social code platform in the country, and they are really trying to support a no wrong door approach and support all the portals and processes that already exist. So it's like, how do you safety net that exists in America? And we're just trying to do it at a local level, right? What can Davis County do to simplify this for our community? And there's no other community in Utah that is trying to do what we are doing. And this is completely community driven. As we learned from some other states and partners and providers, most people have some policy, legislation, like a funded mandate guiding and telling them they must do this work. But we have none of that. This is literally the community saying, this is so important for us to connect our system, to know what exists, to know each other. And so this is what Davis Links has evolved to, because that's what our community has asked for and is in need of. Okay, next slide. So this is kind of how Findhelp shows their no wrong door approach. I mean, they contract with massive healthcare systems and other government agencies, and then us, Davis County Health Department, with our white label or brand, Davis Links. So whether you search findhelp.com or davislinks.org, like, it connects you to this overall resource system, and other people across the country benefit from all the resources we add, and we benefit when other people add resources as well. However, our focus is on making sure that it has all local resources. And okay, next slide, Travis. This just kind of shows all the different industries and sectors that are using Findhelp and the benefits from doing that. So this open network means anyone can use it anytime. It's always up online, and nobody has to create an account to access Davis Links or the Findhelp piece behind powering Davis Links. And it is private and secure. Privacy is super important. So they're HIPAA compliant and high trust certified. So the agencies who have those requirements, there are ways to share your services and make sure everything's in compliance. And then it's flexible, meaning there's multiple ways to find what you're looking for. There's multiple tools. It's customizable. But you can see colleges and universities are using it, correctional facilities, insurance companies, nonprofits, healthcare, government agencies, and local nonprofits. All right, next slide. So as Travis mentioned, when we worked with our Findhelp customer success manager, we did tell her most of our partners are pretty familiar with how to use the search engine to find programs, and most of our providers have claimed their programs. We actually could do a little bit better on that, and that's a goal of ours, to work with more providers to claim their programs. So we were just going to focus on sort of what would be the next steps. After you're familiar with searching, after you've claimed your program, what other pieces of the platform might be available to help you? So we're going to talk through referrals, screeners, favorites folders, analytics, and then some of these new up and coming features with some integrated technology. And we're just going to show you the direction that Findhelp is going that helps us with confidence, knowing that they are in the best place to innovate and support an overall connected system. Okay, next slide. Okay, we're going to dive in and talk about some of these free tools that are part of Findhelp for any provider who's using it. There is a free program management tool. And what that program management tool, and you know what, I would love to hear experiences from those of you who have used some of these tools. So please raise your hand or put something in the chat if you have tried this and there's some experience we can learn from you. We would love to hear that. So through the program management tool, this is where you can update what your services are, your hours, your capacity. This is how you set up inbound referral and applications for services if applicable. This is how you can even publish time slots for people to sign up for appointments if applicable. And then there's a whole suite of tools that help to measure all of your activities, what's coming in, and then how you're responding to that. All right, next slide. So this is also, if any of you want to follow along, I don't know how many of you have 2 monitors, but if you want to, this is our Davis Links providers.findhelp.com. So if you have created an account on our provider site, then you've seen this. And if you haven't created an account on the provider site, davislinksprovider.findhelp.com, then that might be something you'll be interested in. Because once you've got your account, you'll see My Program Tools up in the top, along with people you're helping and other menus that you have. But this is where you access the program tools, and we'll kind of show you some of the things that are in there. Next slide.
Isa, I'm just going to chime in for a second.
Yeah.
So Kaylee just put the Davis Links providers.findhelp.com that you were mentioning. This specific slide that's showing actually goes directly to your claims portion of the Davis Links provider. So I've also included that as a link in the chat. So that's why there's 2 that look similar.
Thanks, Travis. So one of the things, the best things about claiming a program is that you get to pick how you want people to be connected to your programs that meets your needs and meets their needs. So you can accept live referrals, you can have seekers. So that's what we call our community members who are looking for services or support, seekers. You can have them complete a screener that you set up. You can have them set an appointment and more. So this kind of allows you, if you have limited capacity or very strict eligibility requirements, it allows you to be able to kind of funnel some of that. And really, this makes it an easy way for people to get in touch with your program. When a referral is sent, you will automatically get an email, and then you can respond through email. You wouldn't even have to go back into this platform, Davis Links platform. And there's some instructions about how you can edit your programs too. Let's see, Travis, am I on the same one as you? Okay, yeah. So yeah, this kind of shows you the different editing capacities that are there. Okay, next slide. So one-step referrals are really the quickest, easiest, simplest if there's not strict eligibility requirements, and just to kind of get people into your existing pipeline. But you don't learn a lot about the people that are being referred to your program. Next slide. So a screener form is what can be set up if you do want to learn about who's being referred to your program. If you do have some of those stricter requirements or limited capacity, this is one way to help determine if someone is a good fit for your program. All right, and then one of the other tools is the favorites folder. We have used this extensively, and I think I'll share my screen in a little bit and show you guys what it looks like on our end to use some of these tools. But this just helps with your workflows and helps simplify things. So when you have your account, you can easily, and you have a program that you go to all the time, this allows you to save it and to add others to the folder if you want. And so that you don't have to launch a search every time you want to try to find that program again to send it to somebody or to check the details. But one of the ways that we've used this tool is by putting all Davis County Health Department programs in one favorite folder. So that way we can see all 61 of our programs in one place. We don't have to do a search and look for them. We've also used this favorites folder to all the quick links. Hopefully you guys have noticed all of the new quick links on davislinks.org. That is a way where we've saved a favorites folder, which we then made public on the public site, so that by topic and by population, some of our most trusted, often used, essential services for Davis County community members are right there, so that you don't have to do your own search every time. It just depends on, what is most important to you and what programs you access all the time, how to use this favorites folder to just have such easy access to those. Okay, next slide. And this is showing how you can create that favorites folder by, let's see. Oh, and you can share favorites folders. And so this is kind of showing you how you can do that too. And it's easier to demonstrate well in the platform. So we might do that in just a minute too. Okay, some of the other tools that are available are program analytics. So these are the 4 dashboards that are available when you're using Davis Links. And you have the My Activity dashboard. So this will give you analytics about your program, how often it's being accessed. And then if you do set up a screener, this provides you that information about what's happening with your screener, how often the screener is being used. And then there's a claimed program dashboard, and then search trends in your coverage area. So these are tools that they really help demonstrate impact. And if you need to report for a grant or something, or just curious on how you can improve your own program and how people are interacting with it, these analytics will help with that. We, as the admin team for Davis Links overall, have access to really, really robust analytics. And most of you have probably seen us share some of that in our annual report. We were able to show we had 18,000 searches over a certain time period, what our most common search categories were, which zip codes most of those searches are coming from. And so we are also happy to work with you if you have questions about analytics and want to know something for Davis Links overall, or if you're just more interested in how people are interacting with your own programming, your own analytics, you can get that here. Another thing that comes through Findhelp is your referrals, I forget what it's called. It's a regular report. So because I don't, I'm not the program manager for any direct services, it's hard for me to see what this is like for other people who do offer direct services. But I set these referrals up for some of our collaboratives, like Davis for Health or the Behavioral Health Collaboration. So I get a regular referral report. It's always 0 because not many people are being referred to collaboratives. But I can see that if I want that regular report, it just comes through my email. And so that the platform is constantly communicating with you what your data is, how your program's being accessed, if you want to set up tools like that. Okay, next slide. Okay, yeah, we talked about the claimed program dashboard. These are kind of how you can quantify how people are interacting with your program. Okay, next slide. And you can get lots of details here. If there's not a lot of activity, I mean, these numbers are going to be really small, but that might lead you to think, how can we help make our programs more visible in Davis Links, or how can we promote Davis Links as a pipeline to access our programs? Okay, next slide. Oh yeah, this kind of is your search area dashboard. So, your service area, it really focuses in on our local area. Okay, next one. Okay, this shows the Findhelp ecosystem. They really, they started as a resource directory. That's their bread and butter. They've got that down really well, how to search programs, filter programs, map programs, all the details of programs. but they've realized that, they need to evolve to kind of be end-to-end in the social care network. And so the user experience is important to them. And so they're acquiring other companies who are excelling at all of these functions. And so Findhelp, powering Davis Links, is a closed loop referral system, but they're adding these other pieces as they go. So we'll talk about these. So these are just some of the companies that are part of the overall system and that they have acquired. So we'll talk about them one at a time. Next slide. Okay, one of the new things that they just worked on is e-check, is through a company called UNO. And so it's state and federal income-based benefits eligibility check. And I will say that they've hyped this up a lot. They've said, yay, it's now available in Utah, and they've given us a Davis Links portal to do this e-check. And as we have tested it out, we have seen that their e-check takes our community members to the Utah ID login page. And as we tested it and thought, is that actually really simplifying things for our community? Do our community members actually know their Utah ID login? Have they created one? And if any of you have, you know that that is a long, complicated process and, it takes a little bit of time. So we are continuing to work with Findhelp to just understand, is this really the best way to do this income-based benefits eligibility check? And is it really as quick as advertised? I think if you are interested in helping us guide them, we would love more input from you. We aren't advertising this widely yet because we don't want to send our community as something that's going to frustrate them and make it add more barriers instead of less. And so we'd love to work with any of you if you have ideas on what would be that fast pipeline for Utah and for Davis County to do these eligibility checkers for assistance programs in our area. Okay, next slide. So this is what the eligibility check looks like. You answer these questions that are pretty simple. This part's all simple and all great. But what we see is once we do all that, we end up at the Utah ID login page. And it just isn't crystal clear like how I'm going to learn my eligibility from this site. So feel free to guide us if you have good recommendations for that. And hopefully we can learn from some other states who went ahead and did this. They worked with specific states for a while before launching it more nationally. Okay, next slide. And again, one of the things, most people are doing these things from their phone, right? We're showing you on our desktop or our laptop, but all of these are formatted. So and the Davis Links website overall is formatted for mobile view so that this stuff should look good that way. Okay, so this is just a little bit more summary. I mean, like the radically streamlining, we're like, okay, I don't know if we're quite there yet. It sounds great. And they're definitely working towards it. Okay, so this is, if you want to try it out, you can go here. I sort of gave you the warning of what it's going to take you to. But if you have an idea, we've given them some suggestions about websites that might be better, but we'd love your input before we start advertising this to community members. Okay, and then the next company that has been folded into the Findhelp platform is called Keep. That's the K-I-I-P, Keep. Okay, next slide. And Keep is a modern case management tool for community programs. It can help case management activities stay organized, track outcomes, and connect clients to critical resources. It's part of the platform, easy to use, and can really have a huge impact. As we were trained on this initially, we learned that this platform is really helpful for keeping track of documents, those essential IDs and documents people need to prove eligibility. And this tool came in really handy in some communities where they were especially working with those who were unhoused or unsheltered, and where those populations don't have all those legal documents on hand and have a very difficult time finding them, storing them, all of that. So this platform allowed for all of those legal documents and eligibility documents to be uploaded and kept safe, so that the seeker or the member of the community who needed to see about their eligibility or status or something could see that all their documents were in the platform and saved for them. But then also the service providers had access to those documents. And so that's a way to kind of connect and to just continue to fulfill that no wrong door approach, where the documents are accessible to all those who need them. So that was just one example. I think in Davis County, we're super fortunate to work with so many institutions, organizations, and sectors that actually have a lot of infrastructure. You guys come from big organizations who have great technology tools and a lot of infrastructure. And so you probably already all have your own case management system. But a lot of nonprofits and communities that have really small community-based organizations who help these populations accessing safety net, a lot of times they don't have this infrastructure. They don't have technology platforms or products. There's no funding for that. And so these tools come in really handy in some communities where they just don't have those internal systems. So we haven't heard from our partners and community members like you all about, is this something you're interested in? Would this be beneficial in Davis County? Will Davis Links, the people in the network, use something like this? We just haven't heard. So as we're talking through some of these new innovations and these new technologies that are coming through this Findhelp platform, we'd love to hear, what you're most interested in, what you think will help our community to streamline, to connect the systems. And I think in some cases, our community may not be a community that needs some of these, where other communities do. And we're definitely not in a position to tell you that this is better than something you already use. And we have no intention in directing you to use any of these. That's not our role. That's not any authority that we have. We are literally just trying to provide you tools that help you do your job better, as directed by our entire network. So that's something that we just kind of need to hear from all of you, what our next steps are, what our next focuses are. And so we have a survey that will ask you about some of that, but we're open to your feedback as well. Okay, next slide. Okay, because some of these products are new and, learning the ins and outs of them and how they relate to your organization and processes is something that will take a little bit of time to learn. They have office hours. They're supporting the community, doing live Q&A sessions. And so all of our partners and providers are invited to participate in any of these because Findhelp is trying to provide that support to our community. Okay, next slide. So Findhelp in general does have some office hours for providers. As an admin team for Davis Links, the four of us have done lots of consulting, lots of training, and we are happy to be your trusted people, the people that the people that you know how to get a hold of to answer your questions. We are happy to be that. But you also, if you prefer, can learn from Findhelp directly. And they call providers or partners CBOs, community-based organizations. We always tell them in Davis County, that's not exactly how we refer to our providers or partners, because some of you come from statewide institutions that are huge and still find value in being part of Davis Links Network. So when they say CBOs, know that that's you. If you're using the platform, if you're a provider, if you're part of Davis Links Network, you are welcome to join any of their office hours, their trainings. They have Q&A, best practices, tools, and we are able to learn through those opportunities as well. Okay, next slide. Okay, they do have a blog as well. So if you want to be on Findhelp's email list, you can subscribe here. You can go to their website and see. They have actually a podcast. Where they interview different people from different states. I've seen them interview people kind of more from a rural standpoint or a healthcare system standpoint. So there may be something that feels more applicable to you. As you know, we try to provide you with the latest and greatest tips and tools and things that we have going for Davis Links, and that's through our quarterly newsletter. So you'll be getting the September newsletter very soon on September 1st, where we're going to highlight, all of the new stuff that's happened in the last quarter and some of our statistics and things like that. So hopefully we're keeping you informed, but there are other ways to learn more about the platform through Findhelp, and you're invited to do that. But also let us know if there's any additional training that you'd like on any of these topics, or if there's newsletter articles that you would like us to cover that we haven't yet. Okay, let's see. Is there anything else? Is that the last one? Okay, we are at the Q&A portion of this training. And maybe we could do a demo of the provider site to show some of these things if you'd like. Maybe we can just hear from any of you. Have any of you had any experience using any of these tools? Let's start with that. Has anybody set, and you can even just raise your hand if you want, have any, with the, the little raise hand button, have any of you set up referrals? Not yet. Okay. And I think this is normal. Just to reiterate, one of the focuses of Davis Links has been to make sure it is as comprehensive as possible for Davis County. In 2025, our priority was getting every program we could possibly find and think of in there, and 2,200 programs were added. And since then, hundreds more. We thought we knew all the programs, but we're continually finding more, which is fantastic. And when we went to the Utah Social Care Summit, we learned that this is not how other clients of Findhelp do their work. They leave it up to the providers to add all the programs and have to be very proactive in making sure that the directory has programs from the community. But instead of putting that burden on all of our providers, because not every provider is ready to be part of Davis Links yet, they don't have a workflow or they don't even know about it, we proactively went ahead and added those thousands of programs because we truly want this to be the one-stop shop to connect to care for Davis County community members and for all of you navigators and the connectors who are helping with that. So I think that's why in other areas, the referrals have been a key piece. And that's like how they're showing trust between organizations. That's how they're showing impact by how many people are using referrals and if those referrals are leading to services and connection. But our emphasis was building the directory to be as comprehensive as possible. And as most of you know, ours is not just for your low-cost services. Our directory includes a wide scope of anything that contributes to well-being and that provides opportunities for every community member. It's not just a place to get assistance, it's a place to grow and to work towards goals and learn about how you can work towards those goals and opportunities, because those types of offerings are also in the directory. Any questions yet?
I would even add, as you're thinking about maybe any questions, you could be maybe put in the chat what you're excited about based off this presentation, anything that may be useful or beneficial that you might see. And I do want to reiterate, this forum is being recorded. We put on our YouTube channel. If you've noticed in the chat, there's, as she's been going, I have been putting in the links, so you're able to click on those directly.
And I did see the question in the chat about the .org and .com. And sorry, it is a little bit confusing. Findhelp uses .com because they are a for-profit company. But Davis Links uses .org because we want it to feel very community-based, not government, not company. So anyway, sorry, that can be confusing at times, but to get to the provider site, it is the Davis Links providers.findhelp.com. And I think I'm gonna just show that quickly. One of the things that you'll find in the Davis Links provider site as you log in, we talked about, the program tools. You have it in a menu, and then if you scroll down, the program tools are also at the bottom of the page. So there's always multiple ways to get to the tools that are available. And you can see at the bottom of the screen, there's how to suggest other programs, there's how to claim your program. And I think one of the things we are going to work on, well, I know we are, we added all those thousands of programs, and many of you have claimed your program, but there's still many hundreds of programs in Davis counties that have not been claimed. So our goal is to reach out to all of those organizations and say, do you know your program is in the Davis Links network? This is what Davis Links is. This is how you claim your program. We'd really like to see more of our organizations who know their programs in there and have made sure it's up to date and can use all of the tools that are available there. I was going to show you also just the favorites folders. So if we click on favorites folders, this will take just a minute, but we as a team share these with each other so that we all don't have our own separate favorite folders. So you can add people from your organization to your favorites folders, and you can see we've got 4 bowling, 19 gyms, 13 for dental and oral, childcare, immigrant refugee, and many of these should look familiar to you because these are the links that are on the public site, so the quick links. But you can see we also have Davis County Health Department here, 61 programs. I think we might have a Davis Behavioral Health folder too, because they have dozens of programs. Benefit assistance for older adults. I'm sure you would have your own way of using this, but we just wanted to show you how the favorites folders have been really important for our work and to really highlight those local resources that we are going to direct people to on a regular basis. I don't know if there's anything else from the provider site that I wanted to show you, but it looks very similar to the search page of the public site. It's just you end up with your program tools and those tools that help you as a provider, you as a connector, do your work more efficiently. So I'll stop sharing there. The other thing that we have heard from our the Findhelp leaders and other communities is that one of the best practices of Davis Links are these resource forums. Now going 10+ years, nobody could have envisioned 10 years ago what Davis Links would be today in its version, but we've continuously heard from providers, especially those who serve the whole state, how beneficial these monthly gatherings are for Davis Links. And so the fact that you all join and that you care to connect with one another and that you are helping direct this platform is a best practice and what is making this hopefully useful, valuable to you all. So we have worked on this provider survey. We have a goal also for Davis Links to gather provider feedback and user experience data. Oh, Travis, sorry, maybe you're going to be talking about some of this. Should I pause or should I tell
Yeah,
them?
feel free to talk about the provider survey.
Okay. Can I tell them about the customer feedback button too? I will. Okay, so here's the provider survey that we would love for all of you to complete. We'll be reminding you about this and it'll come in your email as well. But we just need to know, and it helps to demonstrate impact, right? We are continuously applying for grants to support Davis Links and keep it going. So as we learn how it is benefiting you and your organization and our community and the direction that you want us to go, that is the most valuable feedback we can receive from you as providers. Just your thoughts and your opinions and your experiences about all of that. And then the way that we intend to gather user experience, I mean, we love to hear from you when you have a community member that has a success. Please tell us when you do. But also we'll be adding a button to the davislinks.org site where people can give their feedback and let us know if they had a good experience, if they were able to find what they want. So as we prepare to roll that out, I'm sure we'll test it with some of you, and we'll make sure that you're aware of it once it gets added so that community members can share what's difficult for them or what's working well for them. Okay, I think that's all I have, but we're happy to answer more questions if there are any.
Okay, thank you, Isa, for all of your input and preparation on short notice. So yeah, if there's no other questions, so we always like to make sure that we're making these forums better for you. So I've just put on the slide the meeting evaluation link. And if you go to the chat, I've added the Davis Links provider survey I was just talking about, as well as the direct link to the meeting evaluation. It's a short little form that just lets us know what you enjoyed about the forum, you know, anything we can improve, and just a few strongly agree to strongly disagree questions. So that helps us as a forum planning committee. And when I say us as a forum planning committee, I am the coordinator. Forgot to mention that at the beginning. And then we have other community partners. So there's the Davis Links admin team, which is Marcy, Isa, Kaylee, and myself. But then there's also a separate Davis Links Resource Forum Planning Committee composed of community agencies. So we appreciate your willingness to take this survey. Like I said, we always go over these in our planning meeting. And I just want to go back to this. Again, just a reminder that next month, Tuesday, September 29th, is the networking event and 10-year anniversary in person at the Davis County Administrative Building in Farmington. Like I said, I will update the calendar invite after this meeting to reflect the correct location. We were going to hold it in one place and needed to relocate here. And I think with that, we are wrapping up, unless anybody has anything else they want to share.
Travis, I just thought of one thing. It's probably a good time to remind you about the welcome kit. So we have just a very simple tutorial guide that will maybe help with next steps from today's training. So it teaches you about how to set up your account, how to claim your program, how to update your information. And so that is on the davislinks.org website. Travis is going to show how to navigate to that, become a Davis Links provider. And so that welcome kit and then some of these other pieces here that have been developed to literally walk you through the process step by step. And of course, like we've offered before, we will walk you through the process step by step over the phone on a video consult. So if you want to take the next steps to using Davis Links more, we're happy to help you in any of those ways.
Yeah, and I would just add, try the Davis Links, directory and see if your program is in there, or if there's anything that you're like, no, this is out of date, reach out to us. And, oh, okay, sorry. And so anyway, you can see on here too that we have progress reports that are periodic, about 6 months or a year. We do those that just give an overall picture of Davis links and what people are searching for, and by different, zip codes and things like that. And then we have our newsletters. This is our little PDF versions of those newsletters, but they're sent out at the beginning of each quarter. And so September 1st, again, expect to see the newsletter, but these are the prior ones that we've sent out for your reference. So, Kaylee, do you want to add anything? No pressure.
I was just going to say something that's a good reminder with the favorites folders too, is that you can also share and print program information from those favorites folders. So that is something that can be helpful if you're trying to send that to a community member. You can send a direct program card information to them, or you could also print it out if an online way isn't working.
I'll also note that when you first sign up for, the website, you create an account and then you claim your program, by default, you will be getting a referral summary each week, I believe it is. And so there's a way to turn that off. And if you have questions about that, so you're not getting spammed with all those emails that you may not want, but you also can change the frequency too. So that is by default. Okay, well, I think we are wrapping up pretty early, and that's okay. So we will see you at the September 29th forum, and just make sure to register using the link. Again, you'll get a follow-up email with the details on the recording, where you can find it, and the materials that we shared today. We will make sure that they're available to you. And like I said, with that, we will wrap up. Thank you, everybody, for attending today.